There have been nearly 4 million confirmed COVID-19 cases in the United States throughout the month of August. A large portion of those infections were reported in Florida, where the debate over school mask mandates is reaching its breaking point. Nichelle Medina reports.
The U.S. is now averaging 156,000 new daily cases of coronavirus. As daily admissions climb, hospitals across the country are running out of ICU beds, especially in the South.
30+% of our inpatient population being COVID positive individuals, and the vast majority of those unvaccinated. It creates a perfect storm.
In Portland, Oregon, 300 National Guard members are on duty to help hospital staff, and more than 16,000 patients are hospitalized in Florida, the most of any state. On Monday, Governor Ron DeSantis said he will appeal a judge's ruling that overturned his ban on mask mandates at schools.
Ultimately, we're just trying to stand with the parents. A lot of parents, they know their kid in terms of the health. Parents' Bill of Rights has said this is your right here.
The U.S. Department of Education announced it is investigating 5 Republican-led states with universal mask bans, saying the policies could be discriminatory towards students with health conditions or disabilities. Nationwide, 180,000 children tested positive during the week of August 12th, raising concerns outbreaks could disrupt more in-person learning. Here in California, the San Diego County Board of Supervisors could be the first in the nation to vote on a policy that would declare health misinformation a public health crisis. Public health experts see health misinformation as a major contributor to vaccine hesitancy. Nichelle Medina, CBS News, Los Angeles.
For more, I want to bring in Dr. Annalee Baker. She's an associate professor of emergency medicine at New York University's Grossman School of Medicine. Dr. Baker, welcome. So you're located in New York City, where more than half the population is fully vaccinated against the coronavirus. How many breakthrough infections are hospitals generally seeing there?
Well, thank you for having me, Elaine. We are seeing a great increase in the number of cases. Certainly, most of the hospitalizations and deaths are among the unvaccinated, but we are seeing breakthrough infections even among those who are vaccinated. Typically, those who are vaccinated have a mild enough course that they don't seek care, so we're not getting great numbers on exactly how many people in the community are contracting the disease after they've been vaccinated. But the greatest danger is still posed to those who are unvaccinated.
Well, the debate over mask mandates in several states is intensifying as more schools across the country prepare to reopen after Labor Day. Remind us why masks are so important for children, especially right now with the severity of the Delta variant.
Certainly. We've always known that masks were important in preventing transmission of the disease, but it's even more important now as we see that Delta virus leads to greater than 1,000 times the amount of viral replication in the nasopharynx, which is the nose and mouth, even among those who are vaccinated. And what that really means, practically speaking, is that although the vaccine provides tremendous protection against severe illness and death, we still see these breakthrough infections, which put especially the elderly and the vulnerable at great risk. And so in our schools, it's extremely important that kids go back vaccinated, especially among these populations, who are younger and aren't even eligible yet to get the vaccine.
Well, the demand for ivermectin, a drug typically used to treat parasitic worms in animals, is sharply increasing, but the FDA has warned the medication does not treat or prevent COVID-19 and may even be toxic to humans. What else should we know about this drug?
That's right. I have fielded requests for this drug myself in my practice and even from friends and family. It's the latest in a series of drugs that people have asked. We've looked to repurpose drugs that were already around, drugs that were cheap and safe and well tolerated, similar to the hydroxychloroquine controversy of last year. Unfortunately, ivermectin, which, as you said, is a parasitic, it's widely used, especially in the veterinary medicine community, but also in certain fields of adult human medicine. It was studied in several trials and found to be completely studies greater than 1,600 patients, which essentially showed that there were. And one of the biggest trials, the Together trial, was actually halted before it was even able to complete because it showed that it was no better than placebo. So unfortunately, our poison centers are seeing a 5-fold increase in calls about toxicity because people are even going to buy animal medicine, essentially, to try to treat or prevent COVID-19, which is extremely dangerous. As you can imagine, patients are taking the incorrect dose, can lead to diarrhea, nausea, all kinds of toxicities, and certainly to no benefit. So we would advise patients against this in every regard.
It's remarkable to hear that you fielded requests for this drug. Let me turn to booster shots, Doctor. Booster shots are expected to be made available to most Americans in 3 weeks. Given the persistence of this pandemic and the spread of the Delta variant, do you believe everyone should be planning to get a booster shot? And if so, what are your concerns about this rollout process?
Well, this has been one of the issues with the pandemic as a whole is the constantly evolving stream of information that we're all getting. It does appear as though certainly in the elderly and immune compromised, a booster shot, as we're calling it, would be helpful in creating greater immunity and protection against the illness. The Biden administration has announced, I think they're trying to roll out booster shots for all in September 20th, if I remember correctly. The CDC Advisory Committee on Immunization Practices met today to discuss this, along with the full FDA approval of Pfizer. And I think that the truth is it remains to be seen whether exactly the right timing of the booster shot and whether all Americans need to be rushing out to get the booster shot. Those of us in the field are also concerned about vaccine equity. I think the most important prime concern for all of us is to get everybody their first vaccine series. So, I think certain people, certainly the immune compromised, the elderly, probably healthcare workers are going to be getting these boosters. But, other Americans, I think, should talk to their doctor and follow the CDC and the FDA recommendations. At this time, I think it's just too early to say exactly when the optimal timing is for a vaccine booster for all people.
All right, Dr. Annalee Baker, thank you very much for joining us.
Thank you for having me.